Hey there, everybody. Good afternoon. I'm Myra Ansari here with Wave Now. Joining me today is Dr. Daniel Blatt, a pediatric infectious disease specialist here at Norton Children's in our community. And we're talking with something that may be floating around in your home right now, the flu. We are not done with that. Dr. Blatt, tell us what we're kind of seeing right now. What's the trend right now in our area?
Yeah, we're still seeing a lot of flu around here. You know, we're in the midst of winter, and normally we associate winter with flu. The last couple of years, it's been a little off, mostly due to the COVID pandemic, but we're right back into normal flu season now.
So what does normal flu season look like for our area?
Yeah, so normal flu season means we get a bunch of influenza cases in both adults and children all throughout the winter. And we're still seeing a lot of flu cases, a lot of positivity. So we're seeing kids who are hospitalized and kids who are just sick at home and have to stay home from school.
From the numbers that I've gathered from you all, you have about 175 positive pediatric flu cases a day right now. That doesn't mean children that are hospitalized. That just means cases where they may have gone to the doctor and it's been reported back, right?
Absolutely correct. I mean, we still do have some hospitalizations because flu can get pretty bad. But in general, we're just seeing a lot of outpatient flu, and that 175 number sounds about right to me. It's really kind of similar to years past, maybe before the pandemic, and it's not going down yet. So I'm hoping in the next couple of weeks it does, but it really could last a little bit longer.
So 175, is that a lot?
It's not a little.
Okay.
Yeah, it certainly is. It's a lot, and it's a lot, but it's also normal for a flu season.
Okay.
Those numbers go up and down throughout the years, and compared to during COVID, it's a lot because we didn't have a lot of flu during COVID.
So your child is sick. They have a fever. They're not doing well. What do you do? Because there's something that folks are doing, and that's kind of not the best approach to handle a sick child right now.
Yeah, you know, as a parent and seeing your child sick, it's really scary. So I think a lot of people tend to want to bring their kid right to the emergency room, which is not always the best option. In fact, typically the best option is to call your pediatrician if you're worried, because your pediatrician knows you and they have the best resources to be able to triage what needs to happen for your child and what needs to happen to keep your child safe. If you go to the ER right away, you may have to wait there for a really long time and be around other sick people. It's not the best option almost all the time. Now, if your kid's really sick, you may have to go to the ER.
If your child has a temperature, and that's probably, I'm going to guess, correct me if I'm wrong, the reason why maybe most parents run to the ER. Yeah. What is kind of a temperature that is, this is not safe, this is alarming versus, okay, I can manage this in a different setting?
It's a really good question. So in general, a temperature is anything above 100.4 degrees Fahrenheit. But that doesn't mean every time you have a fever, you have to go to the emergency room. It's hard to know if there is a specific number that makes you more sick or less sick. Kids can get really high fevers and still be okay. So it's always still best to contact your pediatrician, because we have to take into account what other symptoms the child has, if the child's getting better or worse. It's not just the number on the thermometer.
Is there ever a situation where you think it's the flu that you should go to the ER?
Yeah, if your child is really having difficulty breathing and you can't quickly contact your pediatrician, that may be one reason to get checked out. If your child is not responding appropriately, and again, if you can't contact your pediatrician quickly, that's one reason to go to the ER.
When you do go to the ER, and when you get a number of people coming in with the flu, and that may not be the best thing to do, what ripple effect does that have, if that makes any sense?
Yeah, so it really puts a stress on not only the ER, but the patient and the parent, because the ER will get backed up with people who may have been able to have been taken care of outpatient, and that really inhibits the ability of the medical professionals to take care of the emergencies. And then for the patient and the parent, they're going to be waiting much, much longer than they normally would have, and they're not going to get the care from the people that know them already. So the time to proper treatment may be delayed, and you're not going to get the same kind of follow-up as you would with your pediatrician. It really stresses the whole system.
When we talk about flu season, I know it's nice and warm outside, but still we're not done with the gunk that's out there. What else is kind of floating around right now? And how long does the flu season last?
Yeah, so that's a really good question because a lot of respiratory viruses go up and down and they have waves. Like, for example, we're only seeing a little bit of RSV now, where a couple months ago we had a lot of
it. I remember we were talking a lot about it.
Absolutely. These things come and go, and it's based on a huge amount of factors. So right now, aside from flu, we're seeing just normal cold viruses. There's a lot of names to these cold viruses that we probably don't have time to go into right now.
But. And it's funny because my kid was sick, and we went to like a small little clinic sort of thing, and they were like, obviously your child is sick, but we can't really tell you what exactly it is. There's a plethora of tests that you can take, but it is some sort of gunk that's just traveling around right now.
Absolutely. There are always a different number of viruses floating around, and they all present slightly differently, but mostly the same way. They're the common cold. And for common colds, they're exactly what you would think they are. It's cough, congestion, maybe a little fever, and then after a few days, your child gets better. Now, certainly, if that's not going the expected course, you have to seek medical attention. But for most common colds, for most things out there, it doesn't really matter what the name is, as long as the kid can get better.
Okay. All right. So anything that parents can do to keep their kids healthy. Is it too late for a flu shot?
It is not too late for a flu shot.
Okay.
We are still seeing flu, and I don't know how much longer it's going to last.
Okay.
And the earlier you get the flu shot, the better. It's really good at preventing severe disease. So it may keep your child out of the hospital. It also helps prevent the spread of influenza. So if you know anyone who's immune suppressed or an at-risk patient, you want to keep them safe, it's really responsible to get the flu shot. And the earlier the better, because it takes a couple of weeks to really build that immunity up.
Mm-hmm. And I know that there's folks out there that are watching this today, Dr. Blatt, and they're like, well, I got a flu shot, then I got the flu. It didn't work for me, or I'm not going to vaccinate my child. Everybody has their own opinion. But as a medical health professional, what would you tell folks out there? Does the flu shot give you the flu?
It's normal to be scared of any medical intervention, and you hear a lot of things nowadays, and it's hard to know what to trust. But personally, I spend my life learning infectious diseases, and I can confidently say that the typical flu shot that a kid would go to get at the pediatrician, it's a killed vaccine. It is inactivated. It cannot give you the flu. Some people think they get the flu around the same time as the shot, but that may just be because they were going to get the flu anyway, or maybe because they have a different virus at that same time. But the flu shot cannot give you the flu, and it really does help prevent getting severe disease.
And is it, if I can ask you about COVID as well right now, kind of what are we seeing with COVID with pediatric cases as well?
Yeah, it's a great question. I don't have the numbers off the top of my head, but it's, it seems to be that we're more in flu season than COVID season right now. But COVID also, we haven't really been able to nail down what the typical pattern for COVID is yet. Like, we know for flu, it's typically 1 or 2 spikes a year. For COVID, we've had multiple spikes throughout this entire pandemic. So right now, I think the cases are a little bit lower than flu, but we're certainly still seeing them. And the thing is, the prevention measures are all still the same. So
wash your hands.
Yes.
Yeah.
Wash your hands.
Cough in your elbow.
Exactly. Don't send your child to school if they're really sick. Don't send, if they have a fever. Try not to go to work if you're sick. Help prevent spread of disease. If you know people who are at risk, elderly people, infants, people with medical conditions, try to stay away from them if you're sick. And again, wash your hands, wash your hands, wash your hands.
Yeah.
Try not to touch your face as much, and get all the recommended vaccines from your healthcare provider.
All right, Dr. Blatt, anything that I did not ask you that you want our viewers to know about today?
Yeah, if you're scared about a medical concern or have concern about vaccines or medications, use your resources. And those resources are the professionals that spend their life learning this stuff, and that's your doctor or your other healthcare provider. So go talk to them if you have concerns. It's better than trying to figure it out on your own.
Absolutely. And most pediatricians' office, you can back me up on this. If you call them, they have a nurse practitioner that can speak with you. They'll say, come on in, we'll just check it out, figure out what's going on, instead of you trying to Google it and then you're panicking and you don't know what to do, or you're doing the wrong thing.
Absolutely. We as medical professionals just want to help keep you safe. And so we want you to come to us with your concerns, and then we'll help sort things out for you.
All right, great. All right, let's hopefully keep our kids healthy. I got my kids vaccinated, I want to say a month or two ago. And, I thought, oh my gosh, I'm so late in doing this, but I'm glad I did because we got COVID and the flu at once and it was fine.
It's totally fine to get both at once. You might get a little soreness in your arm. You may even get a fever that night, but that goes away and it does help protect you.
All right. Dr. Blatt, thank you so much for what you do. I appreciate you. I'm Myra Ansari with Dr. Blatt from Norton Children's. I hope you have a great day.